The first recognition of norovirus took place in the year 1972, following an outbreak in Norwalk, Ohio, back in 1968. Scientists discovered a new kind of virus which they initially named Norwalk virus. Today, Norwalk virus is a part of a larger family of viruses known as noroviruses. Moving on to the symptoms, a norovirus infection typically initiates within 24 to 48 hours of exposure. The symptoms often begin suddenly and can include a variety of discomforts such as nausea, vomiting, non-bloody diarrhea, and abdominal pain. In children, vomiting is more prominent, whereas adults usually experience more diarrhea. Myalgia, headache, malaise, and low-grade fever may also occur. While norovirus is unpleasant for anyone, certain individuals are at a higher risk of severe manifestations. This includes older adults, children under 12 months, and those who are immunocompromised. For these individuals, symptoms may last several days longer, and fever is more common. Now, how does this pesky virus spread? Norovirus infections are highly contagious during the acute stage of the disease. However, people can continue to shed the virus for 2 to 3 weeks after symptoms have resolved. Even asymptomatic individuals can shed infectious virus particles up to 3 weeks after exposure. Secondary transmission within households, daycare centers, or nursing homes is common. The virus spreads through the fecal-oral route, which includes person-to-person contact, and indirect transmission through contaminated food, water, or environmental surfaces. It can also spread through vomitous oral transmission if virus particles become aerosolized and are ingested or contaminate surrounding surfaces. Preventing norovirus is not an easy task. The virus can survive relatively high levels of chlorine and temperatures ranging from freezing to as high as 60 degrees Celsius. It is the leading cause of foodborne disease outbreaks, making it a significant public health concern.
It's a process that combines clinical suspicion, laboratory testing, and sometimes a bit of detective work. The journey to a norovirus diagnosis often begins when a patient presents with acute onset of vomiting and watery diarrhea. In such cases, doctors typically lean towards a presumptive diagnosis of norovirus, especially if it's winter in a temperate region or there's an ongoing outbreak. Now you might ask, why not confirm the diagnosis with a test? Good question. In most cases, stool testing isn't necessary. However, in certain situations, such as when a patient is immunocompromised and has severe or persistent symptoms, a stool test can be extremely useful. So what does this stool test involve? It's a bit of a mouthful, but it's called reverse transcriptase polymerase chain reaction testing, or RT-PCR for short. This test can confirm the presence of norovirus in a stool sample. But wait, it doesn't end there. If a patient tests positive for norovirus but exhibits atypical symptoms like dysentery or voluminous watery stools, it's crucial to rule out other culprits. These might include bacterial causes of diarrhea, such as cholera in endemic regions. And here's where the detective work comes in. If more than one person falls ill after a common exposure, it can raise suspicion for a norovirus outbreak. This would prompt the involvement of public health officials for further testing and investigation. It's also important to note that norovirus can be shed asymptomatically. This has diagnostic implications, as diarrhea due to another cause in an asymptomatic carrier may be wrongly attributed to norovirus. Moreover, asymptomatic food handlers can transmit the infection to others, as viral loads on the hands of asymptomatic and symptomatic food handlers during outbreaks are similar. So to summarize, norovirus diagnosis involves clinical suspicion, stool testing in certain cases, and an awareness of the possibility of outbreaks and asymptomatic shedding. But what happens after diagnosis? Most patients begin to recover on their own after 1 to 2 days without specific medical treatment. There are no vaccines or medicines that prevent a norovirus infection, and patients can be reinfected after having the virus. In severe cases, patients may need hospitalization and intravenous fluids, but the best way to tackle norovirus lies in prevention, which includes good hygiene practices like washing hands with soap and water, following food safety practices, and disinfecting environmental surfaces. Isolation of sick individuals until 24 to 72 hours after symptom resolution can also help reduce the spread of infection.